representing LMC and our community brand across the Midlands. Thomas is community, and just a couple of the ways that he is involved in the community, or a few boards that he serves on. United Way of the Midlands, the Free Medical Clinic, Greater Casey, West Columbian Chamber, where he served as a past board chair. Steering Committee for United Way of the Midlands, Young Leaders Society, United Way of the Midlands Education Council. And he's also a graduate of Leadership Lexington County and then also of Leadership Columbia. Thomas is a local guy. Community courses through his veins. He was born and raised in Columbia, got his undergraduate degree from Wofford and a master's in public health from the University of South Carolina. He resides in Columbia with his wife, Ann Griffin, and probably the most important information that you're going to learn about Thomas today is that he and AG are expecting their first child in July.
All right. Can I move the mic if I? Okay. Put a timer up here so I don't take too much of your time today. All right. Thank you, Roger, and thank you to the Chamber for allowing me to present about community health today. I know online and through what you saw that the discussion would be about the community health needs assessment. That will be a component of what I discussed today, but I think it's vitally important to understand, yes, we provide a community health needs assessment every 3 years, but what do we do with that information? What does that mean to us as an organization, and what does that mean to us as a community to provide creative and collaborative initiatives to improve the health of our community? So, Lexington Medical Center Community Health, like I said, community health is collaborative. That is the goal of it, strengthening and maintaining our partnerships to ensure that we have a healthier community. And so, looking at how we start with this, I think ultimately it starts with the mission of Lexington Medical Center, which is to provide quality health services that meet the needs of our communities. As you can see in the mission right behind me, communities is in it. It is a focus of what we do. It has been since the hospital was founded over 50 years ago, and will continue to be for another 50 years. We understand strategically, obviously, the importance of what it means, but also as we drill down programmatically, this is just a high-level view. When I talk about community health, these are the areas I'm going to focus on and how what we do impacts the community through these areas. So we'll look at community outreach, community relations, and occupational health. And these areas specifically focus in order on our clinical preventive services that we provide to the community, some of our strategic partnerships and relationships, and then working with companies such as yourself and employees that work for your companies to provide a healthy workforce and how that integrates into our community initiatives. And then on a strategic level, we have a hospital board committee, the Community Outreach Committee, that evaluates what we do in the community and focuses on this. And it's vitally important that we look from a high level all the way down to day to ensure that we're positively impacting our community. So first I'm going to discuss our community outreach initiatives. As you can see up here, we do a lot of things in community outreach. This is something that I think is very important. Obviously, I do it every day, or I wouldn't think it's very important. But as you can see, if you look at the first few sections, these are, I would consider our preventive services in an outbound setting. We have a group of dedicated nurses that works to focus on health, biometric screenings, vaccines, COVID vaccines, which, as we know, over the past 3 years, we've provided over 135,000 of those to keep our community healthy. And just for a reference point, I'm really using the last 3 years as data because that was the last time we conducted our last community health needs assessment. So as I begin to discuss collaborative efforts and what we're doing with community partners, it's in reference to some of the priority areas that we have identified historically and also 3 years ago and what we have done to positively impact those areas. So as we move through that, smoking cessation, we have a great smoking cessation program, which I'll touch on in a second. Our collaborative efforts through community grants. We have health directions, which doesn't fall directly under community outreach, but physical activity is very important when you think public health and community outreach, and that is our gym, which is also open to the public, but a benefit we provide to our employees. And then if you look at our primary care network, we have population health initiatives such as diabetic educators that work with those that are pre-diabetic and diabetic to ensure that they're taken care of appropriately in our network of care. So that's just a high-level overview. I'm going to drill down a little bit into some of our initiatives. So first I want to talk a little bit about smoking cessation. As you can see behind me, we have an amazing smoking cessation program. One, it is free to the public. So we understand the importance of removing barriers to care when it comes to prevention and providing access. And so this is free to anyone in the community that would like to be a member of the smoking cessation program. It has almost a 60% quit rate, which is, I think, unheard of, and that truly is a testament to the nurses that are dedicated to this compared to the national average of 20%. And this is something we also host around our service area. So in order to provide equitable access to our community members, we offer this at our various locations throughout our network of care throughout the year. And then moving on to some of our more strategic initiatives, I think it's very important to understand, again, collaboration. I hope, at least if you glean anything from this presentation, is collaboration in how we work with our community to multiply the effect of programs and initiatives that we have in our community. So first, I'd like to discuss mental health. Mental health is consistently identified, probably no surprise to you, as a top health concern in our community. Access to mental health services, resources, anything of that nature. And so what we saw from our last community health needs assessment, how can we as a healthcare organization impact this? So you see all these coalition partners behind me. We established Uplift Lexington County in conjunction with all these partners. Duke Endowment appreciated the idea so much that they gave us almost $1 million over 3 years to establish a community paramedic program in Lexington County. So this is directly for your neighbors, for our residents. And what these community paramedics do is they work with high utilizers of EMS and the emergency department and look to reduce call volumes, but also look to provide individuals to the appropriate care setting. So someone that is being transported to the emergency department for some type of behavioral health crisis might not belong in the emergency department. So these community health paramedics are going to work in coordination with individuals that want to seek help through this to ensure that they're given the appropriate care setting. But also it's working in conjunction with law enforcement to ensure that we have appropriate responses for law enforcement when approaching someone who's suffering from some type of behavioral health issue. And then next up, I want to discuss diabetes. Again, diabetes, one of our highest diagnoses in the Southeast. We know that this is a major problem. And so in partnership with Harvest Hope Food Bank, we have established diabetic food pantries in Lexington County over the last 3 years through this. We have distributed over 75,000 diabetic-friendly meals to our community through this program. And this is something that we think is vitally important to, again, provide access to healthy foods and nutritious and appropriate foods. You'll see in a little bit that access to healthy foods is often a barrier to someone wanting to eat healthy. There's also a knowledge gap sometimes, but this is something that we think is very important. And moving into those areas that impact your health is social determinants of health. I'm not sure if you have all heard this term, but really this is the environment that you live in that dictates your quality of life and health outcomes. That can be your built environment, access to healthy fruits and vegetables, access to physical activity, safe walking paths, things like that. And so very excited about this new partnership. As you can see, we implemented it on the 28th of February, but in conjunction with Unite Us, we are establishing a cloud-based platform that integrates into our medical records. So it will allow us to create a closed-loop referral system where our social workers can refer directly to social-based organizations such as Harvest Hope Food Bank, Sister Care, Free Medical Clinic, you name it, and they all work on the same platform. So what this ultimately will benefit our patients, which is first and foremost, but on the back end and strategically, It allows us to collect a robust amount of data and further look to identify gaps in care, areas where we can work with underserved populations and target our initiatives. This is something that we found to be vitally important and partnered with our hospital foundation. We are incurring the cost of this, so it is free for our nonprofit partners to be a part of this network. And we think that is very important when providing access to social-based organizations. Kind of dovetailing off of that, when we're talking about social determinants of care and access to care, is our community outreach grants. So within the past 4 fiscal years, we have provided a little over $4.7 million to nonprofit organizations, many that you probably recognize up there. And what these community outreach grants do is seek to fill gaps in care and work with underserved populations. So if you look at last year's community outreach grants, we were able to provide $1.33 million through that to 26 organizations. Hold on, stop. Yeah. Okay, so these are our 26 organizations last year that we provided grants to. As you can see, these are programmatic grants that work directly with nonprofit organizations. So not only are we investing financially in these organizations, but we are also trying to work collaboratively to create innovative programs with these organizations to ensure that we are creating lasting change. So one, this is a plug. If you are in a nonprofit organization that has, you may think fits the guidelines that you, or priority areas that you see up here, and you don't know about this program or this funding mechanism, please talk to me, ask me about it. I am the liaison for our hospital board committee. Our hospital board committee evaluates these yearly and establishes what the funding will look like. But again, or you may know an organization and you don't see them up here, I am happy to talk with anybody and everybody about what this looks like to better access our those that are most underserved in our community. And then we talk about community education. So obviously, we can't do everything, or you have to do some things by ourselves, right? Collaboration is great, but when community education, driving people to appropriate care settings, getting the appropriate access. So you have probably seen some of this around. If you haven't, I would be very surprised on billboards, but driving people to know when to go to our urgent care or to our emergency room. I think it's very important. Oftentimes people show up in an emergency room setting, but really could be seen in urgent care in a much faster manner. So if you look at the next couple slides, we're talking about these billboards that are around. So very rudimentary probably, but I think pretty effective, get the message across. So go to an urgent care if you're coughing up crud, if you're coughing up blood, emergency department. And then the next one, same thing, very simple. And we are actually keeping these up for a little bit longer. I think they've been very well received, but also drive the point home. Again, simple community education, but important to understand the reasoning behind why we're doing it. And again, to connect this back to our community health needs assessment, why or how do we determine what is most important to our community? Well, it's our community health needs assessment. So what is it, why do we do it, and what are the goals of this? So I've already mentioned it, really, it's a survey that is conducted every 3 years. We've offered it since 2010. It is a requirement of the Affordable Care Act. However, it is something that we have done since 2010, prior to when we were required to do it. We think it is vitally important to understand what our community says to us and how we can positively impact the needs that they identify for us, and then work in conjunction with our community, because ultimately this assessment is about the community. It's about you, it's about your neighbors, and it's about how we can best work together to multiply the effect of our initiatives in the community. And then the goals, again, identify these top health concerns and then ensure that we have effective initiatives to approach them. So this year we partnered, the 2022 Community Health Needs Assessment, we partnered directly with MUSC Health. I see Poonam back there, my counterpart over there. We worked alongside each other, I think very successfully, to have a great needs assessment. And ultimately, as Sean mentioned, this is a statewide tool that we helped pilot with Alliance for a Healthier South Carolina, and DHEC. And the goal of a statewide tool when you're looking at community health initiatives and community needs is really to make it more systematic and standardized so you can compare amongst different regions, see if you're moving the needle when it comes to public health or when it comes to these initiatives. And then if you're not, how can you tinker or tailor that to better serve your community? And then Goodstock, I would like to thank Goodstock. They're the consultant company that we use. So we collected about 1,153 surveys between July and November, which is a pretty good number when it comes to a survey that people are choosing to take. We had key informant interviews, one-on-one interviews, and focus group. It's 35 questions, 6 parts. On your table is a one-pager that has, So this is the one-pager that's on your table. The full report is still in production. Our marketing teams at MUSC and Lexington Medical Center are making it look pretty as they do. It will be available on our websites once it's done, but this really drills down to the key aspects of the needs assessment, and it's identifying our priority health concerns. So I don't think any of these would be surprised, or you'd be surprised by any of these up here, but it's access to care, clinical preventive services, mental health, obesity, physical activity, and nutrition. What I have discussed in our community outreach initiatives earlier directly are things that we're already doing that directly impact these areas, but also that have been identified previously on our other community health needs assessments. And these are things that we will continue to focus on with our other healthcare partners and our other nonprofit and civic partners, government organizations, businesses. I think it's vitally important to bring multiple different voices to the table to ensure that we're effective. So I'm going to run through a couple of the graphs and information real quick. I know that probably won't focus on too much just because I think we can get down into the weeds, and the most important for a high-level view is our prioritized areas, because that's really where we're going to target our initiatives. But this is on your sheet in front of you. How would I rate my overall health? Talked about this. People often identify their overall health as maybe more poor than that of the community. You're waking up every day, you feel your aches and pains, you feel if you're feeling poorly. So that's something where you see that maybe difference between the two. And then as we move forward, this is a busy, next slide, a busy graph, but this really shows when people are selecting what's most important. These are these clinical preventive services. What does clinical preventive services really mean? What is that? Are services that provide the flu vaccines or the routine checkups, the biometric screenings, the heart health screenings that we do in the community. How do we provide access to preventive care to ensure that we have a healthier community? And that's really top heavy, as you can see up there. And as we move to mental health, again, why do people not seek out care for mental health? Oftentimes it has to do with perceived lack of community resources, lack of awareness, stigma associated with that, which we all understand that can be very difficult. And then what are we going to do about that, I think, is something that we've, like I said, through our Uplift program, but trying to think innovatively, creatively, and help lead the charge on what that looks like. Barriers, so healthy eating. As I mentioned earlier, and why we do what we do with Harvest Hope and other initiatives, oftentimes expenses can be something, or lack of knowledge is an area that is identified as a barrier to healthy eating. So what can we do to better impact families and individuals in our community through this? And then finally, physical activity. This is probably no surprise. It is personal choice why people are not physically active. If we had the ability to understand and change motivations like that, then we would not probably be doing a community health needs assessment every year. So I think it's important to continuously think of, again, innovative programs to provide access and break down these barriers that we have in front of us. And I think this is some of what I discussed in our social determinants of health that we're doing with the Unite Us platform too. And so from those, that is really high level, but I think just shows you how people responded. From those, there's an acronym for everything in healthcare and public health, but we create a community health improvement plan, which ultimately is a is an action plan and then an implementation strategy from that, where we can work with our community partners to create successful initiatives that I've discussed from this. So that is high level community health needs assessment, but I think ultimately it's also important to understand organizationally. I've talked about what we do in the community, but I think it's also important that you know individually what our hospital employees are doing in the community, so we tie it back not only as an organization level, but understand that our hospital employees are committed to best serving our community. So I'm going to talk a little bit about our community relations component and how that ties in. So people often see this as sponsorships of events and things like that, which is important, and we definitely do that. We sponsor events that are mostly healthcare related and focus and connect with civic-based organizations. But ultimately, it's participation of our individual employees, buy-in in our mission and what we do and the culture that we've created. Being a locally independent community hospital is very important. And as you can see over the next couple of slides, we have participation in local festivals, parades, which we will also have access at some of those to our mobile mammography unit, screenings. But that's Anissa. For those of you who don't know Anissa, she's our biggest cheerleader for Lexington Medical Center. She's our director of director of staff engagement. But it's great, you see all these runs that we're supporting these events. But also, if you look further, what do our hospital employees do on campus every day? So blood drives. Our employees give over 1,100 pints of blood every year. Talk to the American Red Cross about this. They think that this is the largest amount from any employer in the state and that our employees give in order to ensure that we understand access to blood is key when it comes to specific situations. And also the United Way campaign. We not only support them organizationally, but individually. Our employees give over $135,000 every year to the United Way campaign because of the connection back to their mission and to our mission, understanding, filling gaps in care, and working with those that need it the most. And then if you look at a higher level, community representation, our leadership is represented on it's probably higher than that now, but 22 local nonprofit boards. We also have representation in Rotary clubs, chambers of commerce, as I'm here today talking to you. But it's very important that we're not only, again, involved from an organization level, but our employees, our leadership is invested in our community. And then as I start to close out a little bit, I want to mention and discuss our occupational health and medicine program. So everybody here is an employee or an employer. If you're gainfully employed, you probably spend most of your time at your employer. So where do a lot of your health decisions occur? Probably at your employer, where you're going to get lunch, where you spend most of your day. And so what can we do as an organization to positively impact someone's healthcare while they're in the employer-employee setting? So we have our occupational health department, which has an LMC clinic at 12th Street Extension, LMC Otari Point. We provide visits there and providers there. On-site client and company clinics, so Nucor, Comporium, International Paper, Michelin. We have providers on-site to provide direct care to their employees. And then our mobile medical unit, we can come to you. So we provide services through that as well. And then for our higher level, our executives, we have an executive physical program, which we provided over 130 of those over the past 6 or 7 years. And really this looks to focus on a one-on-one engagement visit for executives at some of these companies. And I think it's a great benefit that we provide. As you can see too, some of our company partners are on the next slide. And really, you probably recognize, this isn't everyone, we have many more than this, but you probably recognize a lot of these partners. And if you are a company and not one of our partners, like Roger said, both individually but organizationally, we would love to take care of you and your employees if that's something that interests you, and happy to discuss what that will look like. And finally, as we connect back to access to care as Lexington Medical Center, our community medical centers. You probably know this one in Lexington as Little Lex or LMC Lexington, but our community medical centers are really important when we're talking about decompressing our emergency department and providing access to care to our community. And so we have 5 of these. You probably see 6 dots up there because we will be opening a new one soon in Casey. This is very important as we identify gaps in care in our community and where we can positively benefit our community. And I have a couple slides looking at the rendering of the volumes. My apologies. So 152,000 visits. This is obviously clearly important to our community. And even more so is our primary care network. We have our leadership from our primary care network here today, where we have I believe 28 internal medicine and family medicine locations throughout our community. It also has almost 600,000 visits last year. So couple that with these visits to the urgent care, we're trying to provide access effectively to our community to ensure that you receive appropriate care in the appropriate care setting. And then, so for Knox Abbott, LMC Casey, which will be our urgent care community medical center, it's right, if you know Knox Abbott and 12th Street Extension, it is right by the Krispy Kreme, which is a nice landmark there, if you know that. So yeah, LMC Krispy Kreme. So it'll be located right there on Knox Abbott Drive, and it will be a great facility, great for that community. And I think the next slide really gives you an idea of what it looks like. It will also have imaging on site, as many of our community medical centers provide imaging labs and outpatient surgery. This one will just be imaging and the urgent care location. So that is everything that I have with regards, at very high level. It's a lot of information, but I think it's vitally important that you understand what we're doing to impact community health. This is probably the first time I've given such integrated presentation about everything that we do in the community, but I think it's important to understand what we do. So I want to thank the Chamber for allowing me to present today, but also our leadership at the hospital for seeing the importance of what we do in the community every day. So thank you so much for what you do. I won't take any more of your time. I will be happy to answer individual questions after this presentation. I'll stick around, talk with you kind of about what we do and what it looks like. So thank y'all.